As men get older, taking care of their health becomes even more important. One part of the body that often gets overlooked is the penis. Good penis health is not just about sex. It's about comfort, hygiene, and staying confident as you age. This guide will walk you through 5 simple but essential penis care tips every mature man should follow daily. These tips use clear, simple words so everyone can understand and use them easily. Let's begin. Tip 1. Keep it clean every day. Cleanliness is the first and most important step in penis care. Washing the penis every day helps prevent bad smells, infections, and skin problems. Use warm water and mild, unscented soap. Gently wash the penis, including the area under the foreskin if you are not circumcised. Never scrub too hard. Be gentle to avoid irritation. After washing, make sure to dry the area well. Moisture left behind can cause fungus or bacteria to grow. Also, wear clean underwear every day. Cotton underwear is best because it lets your skin breathe and absorb sweat. Tight or dirty underwear can trap moisture and cause rashes or infections. Good hygiene keeps you comfortable and confident. Let's go deeper into daily cleaning. Why daily cleaning matters. Every day, your body sweats. Dead skin cells sweat, and oils collect on your skin. If these stay on your penis, they can lead to irritation, bad odors, or even infections. If you're not circumcised, smegma can build up under the foreskin. Smegma is a white, cheesy substance made from dead skin and oils. While it's normal, if not cleaned away regularly, it can cause a strong odor and lead to infections. Proper cleaning steps. Use your hand to gently pull back the foreskin, if you have one. Rinse the area with warm water. A mild, fragrance-free soap is best, as scented soaps can cause irritation. Gently rub the skin to remove any buildup. Do not use scrubbing sponges or washcloths. They are too rough and can cause tiny tears in skin. After washing, gently pat dry with a clean towel. Don't put on underwear until the area is completely dry. Avoid using powders or sprays unless your doctor recommends them. They can cause allergic reactions or dryness. Keeping your groin area clean. Your penis is part of your groin, so keep that area clean too. Sweat and body hair can trap bacteria and cause itching or fungal infections. Wash your groin and buttocks daily as well. Trim pubic hair if it helps you feel cleaner, but always use clean tools and be gentle. Signs of poor hygiene. If you notice a strong smell, redness, itching, or discomfort, it may be a sign that you're not cleaning properly. It can also be a sign of an infection. If the problem doesn't go away after improving your hygiene, see a doctor. Tip 2. Check yourself regularly. It's important to be familiar with your body. That includes checking your penis and testicles for any changes. Once a week, take a few minutes after your shower to gently check for lumps, sores, bumps, or changes in color or size. If you feel something unusual, don't panic. Most changes are not serious, but it's always smart to get checked by a doctor. Also, pay attention to pain, itching, or discharge. These could be signs of an infection. Don't ignore them. Getting help early makes treatment easier and faster. Being aware of your body helps you catch problems early and stay healthy. Let's explore how to do self-checks. When to do it. The best time to check yourself is right after a warm shower when the skin is relaxed. Stand in front of a mirror in good lighting. Look for any changes in shape, color, or texture of the penis. Also, Gently touch and feel the shaft, the head, and the testicles. What to look for? Look for sores, rashes, or any discolored patches. Feel for lumps under the skin. Check the testicles one at a time using both hands. Roll each testicle gently between your fingers. It's normal for one testicle to be slightly larger or hang lower. What's not normal is a hard lump, a sudden change in size, or pain, discharge, or unusual smell. If you see any liquid coming from the tip of the penis when you're not aroused, it could be a sign of an infection. Also, if you notice a strong smell that doesn't go away with cleaning, it might be a problem. Don't wait, talk to a doctor. Itching, redness, or peeling skin. This might be a sign of a skin infection, allergy, or reaction to soap or lotion. If the skin feels dry, flaky, or painful, it needs attention. Simple changes in soap or underwear can help. If not, your doctor can recommend creams or medicine. Why early detection matters. Catching issues early can prevent bigger problems. For example, a small bump could be an ingrown hair, or something more serious like a sign of cancer or an STI. Most issues are harmless, but knowing your body helps you stay safe. Your doctor is your ally. Don't feel embarrassed to talk about penis health with your doctor. They are trained to help. Regular checkups, especially if you notice something unusual, are key to long-term health. The next tip will go deeper into how to maintain sexual health, which is an important part of penis care for older men. Tip 3. Stay sexually healthy. Maintaining sexual health is an important part of overall well-being, especially as men age. Sexual health isn't just about performance. It's about safety, comfort, connection, and confidence. With the right habits, you can enjoy a satisfying sex life while also protecting yourself and your partner. Practice safe sex. Even if you're over 40 or 50, you can still get or pass on sexually transmitted infections, STIs. If you're not in a committed monogamous relationship, it's important to use condoms. Condoms reduce the risk of infections like chlamydia, gonorrhea, syphilis, and HIV. They also help protect your partner. Make sure to use condoms correctly. Always check the expiration date and avoid using oil-based lubricants with latex condoms, as this can make them break. Keep condoms stored in a cool, dry place. Carrying them in your wallet can weaken the material. Regular STI testing. Some STIs don't cause symptoms right away. You may feel completely fine and still have an infection. That's why regular testing is important, especially if you have new or multiple partners. Talk to your doctor about how often you should be tested. Testing is private, quick, and can protect your health and your partner's health. Open communication. A healthy sex life includes open and honest communication with your partner. Talk about your sexual history, protection, and boundaries. Being respectful and honest helps build trust and reduces misunderstandings. If you have a new partner, discuss STI testing together. This isn't always an easy conversation, but it shows maturity and responsibility. It can also help avoid problems down the line. Erection health and performance. It's common for men to experience changes in erection strength or duration as they age. This can be due to blood flow problems, stress, or other health conditions like diabetes or high blood pressure. If you find it difficult to get or keep an erection, you are not alone, and you don't have to suffer in silence. There are safe treatments available. Medications, lifestyle changes, and therapy can help. Talk to your doctor about what's right for you. Avoid buying unproven or fake treatments online. These can be dangerous. Stay sexually confident. Confidence plays a big role in your sexual health. Honest and open will help you feel more relaxed and connected. Remember that sex is not just about performance. It's also about intimacy, pleasure, and connection. Focus on communication and mutual satisfaction. Keep your genitals comfortable. Use lubricants during sex if needed, especially as natural lubrication can decrease with age. Choose water-based lubricants that are safe and gentle. This helps prevent friction, pain, or skin damage. Avoid using household products or flavored lubricants that are not designed for sensitive areas. By staying safe, being honest, and caring for your body, you can keep your sex life healthy and enjoyable for years to come. Tip 4. Support your penis health with diet and exercise. What you eat and how active you are affects your entire body, including your penis. A healthy lifestyle supports better blood flow, stronger erections, higher energy levels, and greater overall comfort. Eat for blood flow. Your penis needs healthy blood circulation to function well. Foods that are good for your heart are also good for your penis. Eat plenty of fruits, vegetables, whole grains, lean meats, and healthy fats like olive oil and nuts. Leafy greens like spinach, fruits like berries and oranges, and heart-healthy fats like avocado and walnuts all help your blood vessels stay flexible and strong. Limit processed foods, fried foods, sugary snacks, and too much alcohol. These can clog your blood vessels and slow down circulation. Good circulation means better erections, more sensation, and more sexual satisfaction. Drink plenty of water. Staying hydrated helps every part of your body work better. Dehydration can affect your energy, your mood, and even your ability to get or maintain an erection. Try to drink at least 6 to 8 glasses of water a day, more if you're active or hot outside. Exercise regularly. Physical activity boosts blood flow, helps control weight, and keeps your heart healthy. All of these are important for penis health. Aim for at least 30 minutes of moderate exercise, like walking, swimming, or biking, 5 days a week. Exercise also helps reduce stress and improve your mood. Stress and anxiety can affect your sex drive and performance. Regular activity helps you feel better, sleep better, and think clearer. Strengthen your pelvic floor. Pelvic floor exercises, also called Kegel exercises, can help men improve bladder control, erection strength, and sexual performance. To do them, tighten the muscles you would use to stop urine mid-flow. Hold for a few seconds, then release. Repeat this several times a day. Avoid smoking. Smoking damages blood vessels and reduces blood flow to the penis. Over time, this can lead to weaker erections. If you smoke, talk to your doctor about ways to quit. There are many support options available. Watch your weight. Being overweight or obese increases the risk of diabetes, heart disease, and hormonal imbalances. All of these can affect your sexual health. Even losing a small amount of weight can improve circulation, reduce stress on your body, and boost testosterone levels. By eating well and staying active, you help your penis stay strong, healthy, and responsive. In the final tip, we'll look at the importance of regular medical checkups and staying informed about men's health as you age. Final thought. Taking care of your penis is a vital part of your overall health as a mature man. These 5 tips, keeping clean, checking yourself regularly, staying sexually healthy, eating well and exercising, and visiting your doctor, may seem simple, but they have a big impact on your comfort, confidence, and well-being. It's easy to overlook penis health until something goes wrong, but with a little daily care, you can prevent many problems before they start. Good hygiene helps you feel fresh and avoid irritation. Regular self-checks help you catch any unusual changes early. Practicing safe sex and staying informed protects both you and your partner. Healthy food and regular movement support blood flow and sexual performance. And staying in touch with your doctor ensures you're not missing anything important as you age. Remember, aging doesn't mean giving up comfort or confidence. It just means being smarter and more proactive about your body. Your penis is part of you. Treat it with the same respect and care you give the rest of your health. When you do, you'll feel better, live better, and continue enjoying the things that matter most.